Good afternoon. It is February 1st, 2026. My name is David Knox, and I've had multiple system atrophy for 5 full years based on symptoms. I was thinking of what to do for a video because I owe it to you, just those that follow me, those that will come after me to see how progression starts and how it ends. The difficulties we have with MSA. And I'll tell you one shocker. I never thought I would lose my voice before I lose my legs. So I'll still be walking, going places. I won't have a voice for very long. Spasms in the vocal cords are giving out. This presentation might be a little lengthy because I want to share a video file, an audio file, a PowerPoint deck, and maybe an Excel sheet with a timeline of my symptoms. So if you would indulge me, I will try my best not to talk too much. I feel I've used a lot of AI to put some things together, and I had to go back and double, triple, quadruple check the accuracy of the AI. So it's going to do most of the talking for me because it's going to explain my situation with MSA. And I'll sit back with some coffee for a minute, and we'll listen to some things. So, first one I want to show is a video. Again, this was created based on a lot of information that I put into this. Both this file, this video file, and the audio file tells my story. More or less tells my story. So we'll start with the video file. Well, if we were sharing sound. So
The Unfolding Syndrome. I mean, that sounds like the title of a medical thriller, right? And honestly, that's kind of what this is. We're going to dive into this incredible 4-year journey to a diagnosis. It's a real story about how doctors have to become detectives, piecing together a puzzle one tiny clue at a time. All right, let's get right into it. What you're seeing here is the cover of the actual case study that got us so interested in this topic. And it really sets the stage for everything we're about to talk about. It describes this 4-year odyssey from what they call prodromal noise, which is basically just a fancy term for early, super confusing symptoms, all the way to systemic failure. So yeah, this isn't just a dry medical report. It's a story, a narrative of discovery. And that really gets to the heart of the matter, doesn't it? It brings up this huge question. When a person has all these different health issues popping up over years, things that seem totally random, how on earth do doctors finally connect the dots and realize it's all pointing to one single disease? Well, the way to think about it is through this really great metaphor, finding the signal in the noise. So the noise, that's all the confusing, scattered symptoms, the stuff that could...
what they're saying, I train people in real life for. What you see in the orange right there, yellow, is a sine wave of electromagnetic signal. That's how you get cell phones, TV, things to your house. If you're not using fiber, or you're using fiber, copper, twisted pair, that's a sine wave. And our biggest issue in telecommunications is noise. Noise will stop your TV, stop your internet, stop your cell phone. It will knock it down because there's too much noise overriding your signal. So this is home about talking about the signals and noise. We would call it a signal to noise ratio. That's how bad or how good it was. So very interesting that this would show up with my background in signal analysis.
Way to think about it is through this really great metaphor, finding the signal in the noise. So the noise, that's all the confusing, scattered symptoms, the stuff that could mean anything, right? It could point in a million different directions. But the signal, That's the one true hidden pattern that points to what's really going on. And today, we're going to follow that signal. Okay, so our story starts where so many of these medical mysteries do, not with some huge dramatic event, but with a whisper. We're going right back to the very beginning, to the first really subtle hints that something wasn't quite right. So we're setting the clock back to 2021 and pushing through into 2022. For these first 2 years, you have to understand the symptoms were, well, they were subtle, they were sporadic, and honestly, they could have been caused by just about anything. And check this out. What's so wild here is how normal these complaints seem. I mean, we're pulling this directly from the clinical log. In 2021, 2022, you see things like low back pain, arthropathy, which is really just a catch-all term for joint pain, dizziness, fatigue, even being unsteady and having a few falls. Look, on its own, any single one of these, you could just brush it off, right? And that's the real problem, isn't it? The fundamental challenge. These first symptoms, they don't scream rare, scary disease. They whisper things like getting older, or maybe you overdid it at the gym, or just plain stress. At this stage, finding a single diagnosis is, well, it's impossible. It's completely buried in all that static. But then things start to shift. That noise we were talking about, it starts getting louder. Those scattered symptoms, they start to line up, to form a pattern. And it's an alarming pattern, one you really can't ignore. This little comparison here just nails the change. You see it, right? We go from these vague, general ailments to very specific, systemic issues. What were once scattered complaints now look like they're coordinated. And those routine checkups, they're now a frantic series of specialist visits. The whole picture is changing, and it's happening fast. So here's the game changer. Clear neurological signs start showing up. The clinical notes from 2023 and 2024 are just full of them. Things like a new tremor, muscle wasting and atrophy, actual changes in cognitive function, dysarthria, which is the medical term for slurred speech, and a really clear difficulty with walking and coordination. Okay, we are way past just back pain now. And it wasn't just about movement. The autonomic nervous system, the one that runs all the stuff in the background you never think about, like breathing and blood pressure, that was in trouble too. The patient records start showing things like urinary urgency, trouble swallowing, sleep apnea, and those falls from before. Now the notes say repeated falls. See the escalation? This is the turning point, right here. The problem has officially crossed a major line. It's not just in one place anymore. It's hitting multiple body systems all at once, the musculoskeletal, the neurologic, and the autonomic. It is, by its very definition, a multi-system problem. So now, with all this evidence piling up from different parts of the body, the doctors could finally start connecting the dots. They could start looking for that one single answer that explains everything. In 2025, that's the year it all comes to a head. The records show that in March, they're thinking maybe it's Parkinson's disease and a separate autonomic nervous system disorder. By April, they've refined that. Now they're calling it Parkinsonism and multi-system degeneration of the autonomic nervous system. You can feel it, right? They are getting so close. And then, in July, bam, the final piece of the puzzle just clicks right into place. Multiple system atrophy, or MSA. That's it. That's the signal they've been hunting for through 4 years of noise. The one name that makes sense of it all. 4 years. Just think about that. 4 years from a simple complaint of back pain to this devastating but final diagnosis. 4 years of symptoms, countless tests, and just crushing uncertainty. So what exactly is multiple system atrophy? Well, it's a rare neurodegenerative disorder. And really, it does two main things. First, it goes after those autonomic functions. The involuntary stuff like blood pressure and bladder control. And second, it causes movement problems, tremors, rigidity that can look an awful lot like Parkinson's disease. Okay, so now that we have the answer, let's take a step back and look at the whole picture again. Because now we can finally see how all that confusing noise came together to form one clear and, tragic signal. Remember this image from the very beginning? At first, it just looked like some abstract chart. But now it tells the entire story, doesn't it? You can see that one single starting point on the left and how it just branches out into all these different chaotic symptom pathways on the right. MSA is usually broken down into three main components. First, there's autonomic failure. That's the urinary problems we saw and something called orthostatic hypotension, which is just a fancy way of saying your blood pressure tanks when you stand up, making you dizzy. Second is Parkinsonism. That covers all the motor stuff like the tremor and rigidity. And third, cerebellar dysfunction, which leads to gait ataxia, or that really severe difficulty walking. And if you think about it, every single thing from that patient's 4-year journey fits perfectly into one of these boxes. This quote from the report just hits the nail on the head. Scattered, nonspecific symptoms slowly coalesced into a definitive diagnosis. I mean, that says it all, doesn't it? Things that were probably just written off as separate orthopedic issues or urology problems, they slowly and painstakingly came together into this one clear picture. And really, that's the big takeaway from all this. Getting a diagnosis, it's not always some big aha moment. A lot of the time, it's more like a story being written one page at a time, one symptom at a time, until finally the whole narrative makes sense. Which, of course, leaves us with one last really big question. This patient's 4-year ordeal shines a huge spotlight on a major challenge in medicine. So, how do we get better at spotting these faint patterns earlier? How do we train ourselves, and maybe even our computers and AI, to find that faint, critical signal hidden in all the noise, but to find it sooner?
And that's what the question is. It's very difficult to put two and two together and get four very early on with anything. Anything. It's taken the better part of 4 or 5 years just to get a CT of my lower spine of the right area that below the lumbar, and the S is the Caesar S is on the cervical, just down below. It took one doctor up to 5 years of finally say, "Hey, let's check this area out." By the way, it's falling apart very badly, right? Severe did, and we have to go burn some nerves and stuff, so I can walk properly. It's how do we find this quicker?
Welcome back to the deep dive.
That is just 16 minutes. Gives more details, and it's back and forth from my medical records, very specific, and it gives two sides of every story. And it gives you details. Now, the one thing it seems to be missing across the board was since I did not on February 21st, 2021, since I did not go to a hospital and say, "Hey, my legs are dragging," I just ignored it for like over a year. You don't see it documented in any of the medical charts. But in February 21st, dragging up my feet, walking into Kohl's with my wife was the first symptom that I know of. Okay, so you may not see that on here, but that's what it was. Let's go ahead and play this one. But there is no video for this one. But I believe you will enjoy the audio. It's very thorough. I'll just stand here, watch the blank screen.
Today is Friday, February 20th, 2026. And usually when we crack open a case study or some research, there's this comfortable distance to it. Right?
Yeah, we're usually looking at history.
Exactly. History, something that's already resolved.
Yeah.
But the stack of documents we're diving into today, the ink is, it's barely dry.
It really is.
The last entry in this data trail is from February 18th. That was literally 2 days ago.
Right, which definitely changes the energy of this deep dive. We aren't acting as historians today. We're acting as observers to a crisis that is still unfolding.
Yeah.
This isn't some textbook example from a decade ago. It's a living, breathing medical reality.
It is. And at first glance, if you just look at the raw source material, it looks like a chaotic mess.
Totally.
We're looking at a document titled Comprehensive Clinical History, and it is just thousands of rows of medical codes, billing entries, notes, all spanning from early 2021 right up to this week.
But we also have this conceptual chart, right? The unfolding syndrome.
Yes, unfolding syndrome chart. And that's going to act as our map for you today.
And we desperately need that map because our mission today is to solve a puzzle. We need to trace how a person goes from standard everyday complaints,
Like a sore back or something.
right? A sore back, some anxiety, a bit of joint pain, how they go from that to a diagnosis of a rare catastrophic neurodegenerative disorder.
Right.
We are tracing the path of multiple system atrophy, or MSA.
MSA, terrifying acronym for those who know it. But before we get to the actual diagnosis, we kind of have to live through the confusion, just like the patient did.
We do.
The data starts in 2021, and the chart labels this period the prodromal noise. Now, for the layperson, prodromal basically means the prequel, right?
Yeah, exactly.
Like the symptoms before the actual disease shows its face.
Think of it as the rumble before the earthquake. In neurodegenerative diseases, the pathology, the actual damage in the brain, it starts years, sometimes decades before the classic symptoms appear.
Decades. Wow.
Yeah. But the noise part of that label is crucial here. The early symptoms are so generic, so common, that they act as camouflage.
I want to walk through the logs from 2021 then, because this is where the detective work gets incredibly frustrating.
It really does.
If I'm a general practitioner seeing this patient, I'm not thinking brain disease. I'm seeing a middle-aged guy who maybe played sports too hard or just has bad luck.
Right. You look at the chart and see
Spondylosis in the spine, rotator cuff strain, bursitis, rheumatoid arthritis appearing in the knees. I mean, it reads like a standard orthopedic nightmare.
And that is exactly the trap. You see a shoulder problem, you send them to an orthopedist. Right. They treat the shoulder, they give anti-inflammatories. But here is the insight that most people, and honestly, even many doctors, miss in the early stages.
What's that?
Rigidity and things like frozen shoulder are often the very first motor signs of Parkinsonian disorders.
Wait, so a frozen shoulder can be a brain issue?
Absolutely. The brain is failing to send the relaxed signal to the muscles. So the muscles stay tight, the joint stiffens, and it looks exactly like an injury, but it's actually central rigidity. And because it looks like a sports injury or just normal aging, nobody connects it to the neurology.
That is wild. Some pain of hip region and the myalgia listed here in late 2021. Those might not have been joint issues at all.
They were very likely muscle rigidity caused by the brain's motor loops beginning to fail.
Okay.
But it gets even trickier. Look at the urology logs from early 2021.
Yeah, I see that. February and March 2021, we have testicular pain, hydrocele cystic epididymis.
Right.
Again, it seems like a very localized issue. You go to a urologist, you get checked out, maybe get a minor procedure.
Precisely. But in the context of MSA, this is a massive red flag in hindsight.
Really?
Yeah. Vague pelvic pain, erectile dysfunction, and urinary issues are often the earliest signs of autonomic failure.
Autonomic, meaning the automatic stuff.
Exactly. The autonomic nervous system controls the things you don't think about: blood pressure, digestion, sexual function, bladder control. When that wiring starts to fray, it very often hits the pelvic region first.
So paint the picture here for us. You have a patient seeing an orthopedist for his shoulder and his knees,
Right.
a urologist for his pelvis, and then looking at the 2022 logs, a psychiatrist for anxiety disorder and obsessive compulsive personality disorder.
It's the silo effect in action. The psychiatrist sees a stressed, anxious patient.
Makes sense.
But we know now that neurodegeneration changes brain chemistry long before it changes movement. That anxiety wasn't just stress or a reaction to the pain, it was likely organic, a physical change in the brain's emotional regulation centers.
It's just so frustrating to read this, knowing what we know now.
Assessed with anxiety and bipolarism many, many, many years ago. But if you read into bipolar, most of it is from a lack of dopamine. Not like in MSA where we lose everything for dopamine, but it's generally ADD and bipolarism is from a lack of dopamine. When you tell doctors, they put stuff on charts. So I had both those long before this disease came running at me.
Feels like everyone is looking at a single puzzle piece and completely ignoring the picture on the box. But the unfolding syndrome chart suggests that in late 2022, the signal finally starts to break through all that noise.
There is a specific pivot point in the data. Look at October 2022.
I see it. Unsteadiness on feet and falls. And just before that, in September, dizziness and giddiness. Is that the first real clue?
That is the moment the clock starts ticking for a neurologist. You might have bad knees, you might have a bad back, but you don't typically just start falling down out of nowhere unless your balance center is compromised.
Right.
And combined with the dizziness, that's not just vertigo. That is likely the blood pressure system failing to fight gravity.
Which brings us right into the next phase. The outline calls 2023 and 2024 connecting the dots.
This is where it shifts.
Yeah, this is where the doctors finally realized this isn't just arthritis and anxiety.
Yeah.
And in September 2023, we see the big code enter the chart, Parkinson's disease.
Finally, they're looking at the brain. But this brings us to the lookalike problem. The source material references MSAP. That stands for the Parkinsonian type of multiple system atrophy.
So there are different types of MSA.
Mainly two. MSAC, which affects the cerebellum, think coordination issues like a drunk walk, and MSAP, which mimics Parkinson's disease.
Yep.
You get the stiffness, you get the tremors, and we do see tremor logged in June 2023. You get that slowness of movement.
So if it looks like Parkinson's and it acts like Parkinson's, why isn't it just Parkinson's?
That is the million-dollar question for every neurologist out there. In the logs, notice how the diagnosis kind of wobbles?
Yeah, it goes from Parkinson's to Parkinson's without dyskinesia. There's this hesitation.
That hesitation is usually the doctors realizing the standard drugs aren't working.
Explain that for us.
Mhm.
Standard Parkinson's has a specific drug, right?
Yes, levodopa. It's synthetic dopamine. In standard Parkinson's, you give the patient levodopa, and it's almost miraculous. The stiffness melts away, the tremors stop. It's like flipping a switch.
But not for MSA.
Right. In MSA, the problem isn't just a lack of dopamine. The cells that actually receive the dopamine are dying too.
I've heard the analogy of the car engine for this.
It's a great analogy. In Parkinson's, you're out of gas. You put gas in, the car goes.
Mm.
MSA, the spark plugs are dead. You can flood the engine with fuel, which is the levodopa, but if the spark plugs aren't firing, the car will not start.
That makes total sense.
Laura knows that us men, us men have done that before. Flooding the engines, for older cars. That's a great example.
So the lack of response to the meds was a huge clue. Looking at 2024, the symptoms start getting, well, bizarre and terrifying, honestly.
They do.
This is where the lookalike theory falls apart and the real monster shows itself.
2024 is absolutely the clinical turning point. The disease stops whispering and it starts shouting.
The sleep entries really stood out to me here. January 2024, parasomnia, and then REM sleep behavior disorder. I've heard of that. Isn't that where you act out your dreams?
It is, and it's an incredibly specific red flag. Normally, when you enter REM sleep, dream sleep, your brainstem sends a signal to paralyze your muscles so you don't run around or hurt yourself.
Right. So you stay in bed.
Exactly. But in synucleinopathies, which are diseases like MSA and Lewy body dementia, that switch breaks.
So they aren't just tossing and turning.
No, patients will punch, kick, scream, or jump out of bed while they are fully asleep. It is violent. And here's the kicker. It is almost a 98% predictor of neurodegeneration.
98%. It's basically a guarantee.
It's one of
Guaranteed.
the strongest prodromal markers we have. If a patient has REM sleep behavior disorder and then starts having falls, it is almost certainly not just Parkinson's. It's something much more complex.
And then we have the throat issues appearing in the same year. Dysphagia, which is swallowing difficulty. Dysarthria, slurred speech. And this one sounds particularly scary. Laryngeal spasm.
That laryngeal spasm is terrifying. It's also known as stridor. Basically, the vocal cords suddenly slam shut when they should be open.
Oh my God.
You literally cannot breathe for a few seconds or even minutes. It makes this high-pitched gasping sound. It's a hallmark of MSA that you rarely see early in standard Parkinson's.
And the autonomic issues come back with a vengeance in 2024 too. Neurogenic bladder, orthostatic hypotension.
Orthostatic hypotension is the silent killer here. This is when your blood pressure plummets the moment you stand up.
Because the system is failing.
Right. A healthy body squeezes the blood vessels in your legs to keep blood in the brain. An MSA body forgets to do that. You stand up, the blood drains to your feet, and you faint.
So you have a patient who is stiff, shaking, acting out violent dreams, choking on food, and fainting when they stand up. The evidence is overwhelming at this point.
It is. And the logs reflect that realization. Look at late 2024. August 30th, the code finally appears. Multiple system atrophy.
And then October 31st, striatonigral degeneration.
Okay.
Sounds ominous. What does that actually mean physically?
It refers to two specific areas of the brain, the striatum and the substantia nigra. In MSAP, these areas essentially turn into scar tissue, a glial scar. On an MRI, you might see what's called the hot cross bun sign. It's a specific pattern of atrophy in the brainstem. That diagnosis in October 2024 was the moment the doctors stopped guessing. They actually saw the scar tissue.
So they finally have the name, But reading the 2025 logs, getting the right name didn't seem to help the patient at all. The outline calls this phase the three pillars of failure.
That's referencing the three systems crashing at once: autonomic, motor, and cerebellar. By 2025, the body is fighting a war on three fronts and it is losing on all of them.
Let's talk about the respiratory collapse because this just looks brutal. Acute respiratory failure with hypercapnia, recurrent pneumonia, pneumonitis due to inhalation of food.
This is the tragedy of dysphagia. Inhalation of food or aspiration pneumonia is the leading cause of death in these cases.
Because they can't swallow properly.
Right. You try to swallow water, the muscles don't coordinate, it goes into your lungs and bacteria bloom. It causes massive infection. But hypercapnia is different. That's even scarier.
That's high carbon dioxide levels in the blood, right?
Yes. But ask yourself why it's happening. It's not because his lungs are broken. It's because the automatic signal from the brainstem that says, hey, breathe deeper, CO2 is high.
That signal is failing.
Exactly. This is central hypoventilation. The patient can literally forget to breathe while sleeping.
Wow. That explains the entry in March 2025. Dependence on other enabling machines and devices. He's likely on a ventilator or a BiPAP machine at night just to keep the gas exchange going.
He is. He is tethered to technology for basic survival.
And at the same time, his mobility is completely gone. Frequent falls in July 2025. We see mentions of a left artificial shoulder joint and a wheelchair. It seems like the falls from 2022 eventually caught up with him.
It's a vicious cycle. You have the balance issues plus the orthostatic hypotension. You stand up, you black out, you fall, you break a hip or a shoulder.
And surgery would be risky.
Surgery is incredibly dangerous because the anesthesia messes with an already broken autonomic system. The impaired mobility log we see is essentially the transition to being bedbound or chairbound.
The third pillar mentioned is the mind. Altered mental status, depression, symptoms involving cognitive functions. Is this dementia?
MSA typically spares the thinking part of the brain longer than Lewy body. But altered mental status here is likely metabolic.
Oh, because of the breathing issues.
Exactly. If your oxygen is low and your CO2 is high, that hypercapnia we talked about, you get confused, you get delirious. The brain is literally suffocating.
And the depression.
Imagine the psychological toll. You are fully aware. MSA patients often stay sharp. You are watching yourself dissolve. You are trapped in a body that is failing you in every conceivable way.
Which brings us to the present. The current state logs from January and February 2026. Most recent entry is February 18th. This other muscle spasm, diseases of pharynx.
Notice this shift in the data, though. In 2024, the logs were all about discovery. MRIs, specialist visits, diagnostic codes. In 2026, the logs are purely about management. Encounter for therapeutic drug level monitoring, viral pneumonia.
It feels like they're just putting out fires.
That is exactly what palliative care is in this context. There is no cure for MSA. There is no treatment to slow it down. The goal now is simply to manage the chronic pain syndrome, keep the airway open, and try to maintain some quality of life.
There's so many pain entries recently. Pain in shoulder, pain in leg. Why is there so much pain now if he's barely moving?
The other muscle spasm from 2 days ago gives us a clue. Dystonia. The muscles contract violently and they just stay that way. It can be excruciating, twist the limbs. Plus, the immobility leads to pressure sores and stiffness. The body is under siege.
And dysphonia, voice disorder, recorded late last year.
The voice becomes a high-pitched, strained whisper or a quivering rasp. Communication becomes a massive effort. So you have a patient who is in pain, immobile, struggling to breathe, and struggling to tell anyone about it.
It's so heavy. When you look at a code like G9.3 on a chart, it's clinical. But behind that code is a human being living through an absolute nightmare.
And a family watching it happen.
So if we zoom out, we're looking at a 5-year timeline. 2021, a guy with a sore back and some urology issues. 26, total systemic failure.
The unfolding syndrome. It reveals itself so slowly that you don't see the pattern until the damage is already done.
It really highlights the flaws in our medical system, doesn't it? We are so hyper-specialized today.
We are. The urologists did their job perfectly. Orthopedists did their job perfectly. The psychiatrists did their job.
Sure.
They all treated the specific symptom in front of them.
But nobody saw a constellation.
Because nobody was looking at the whole sky. In complex neurodegenerative diseases, the noise, the back pain, the bladder issue, the anxiety, that is the signal. But our system isn't designed to aggregate that noise. It filters it out. It categorizes it into different departments.
We're trained to look for horses, not zebras. But sometimes it's not even a zebra. It's something far more complex.
Knowledge is the only defense here. If we can recognize that REM sleep behavior disorder plus erectile dysfunction equals a brain risk, maybe we catch these people in the prodromal noise phase.
Oh, what difference would that really make? You said there's no cure.
We can't cure it yet, but we can stop the unnecessary surgeries that make them worse. We can stop the wrong medication. We can prepare the family. And most importantly, we can validate the patient's experience so they don't spend 3 years thinking they're just falling apart or going crazy.
We can give them the dignity of knowing what they're fighting.
Exactly.
We want to thank you for taking this journey through the data with us. It's a sobering look at the reality of rare disease, but a really essential one.
It was a difficult but necessary.
Before we sign off, I want to leave you with a thought. We live in an era where we can sequence a genome in a day and use AI to fold proteins. But for this patient, the most critical data points, a fall on the shear, a bad dream, a dizzy spell, were scattered across 3 different clinics and lost in the noise for years.
Yeah.
So, who is the architect of your health? If you have 10 different contractors working on your body, who is the one checking the foundation?
That is the question we all need to ask.
Something to think about. Thanks for listening. We'll see you on the next deep dive.
Since this doesn't include my feet as my first symptoms of MSA in 2021. It starts from the end of 2021, where I go to a rheumatologist about my hands. Every dot here is a visit, a follow up, and a test. Every dot, there are many dots. You can see by year. Now, here's what makes this difficult to put into words. My first 2 years, 2 to 3 years, mostly muscle skeletal that you heard in the video and audio files. There were some red flags, as it says here, RBD, Parkinsonisms, tremor, and falls. I went to my rheumatologist at the end of 2022 and asked, am I just getting old? Is this me getting old? And she laughed at me, not in a bad way, but she chuckled and said, no, it's not. Many more years to go before this happens. That's when she said, I need to go see movement disorder specialist at a university. But at the same time, now you can take 2026 off of this chart. It just turned 2026. So if you go from 2024 to 2025, 2 years versus 3 or 4, 2021, 22, 23, and just 2 years to 2024 and 25. All my autonomic systems started to fail. And how bad did it actually fail? Well, I have a chart for that. I'm failing this fast. The disease, it is subtle. I don't go to the hospital or doctor for anything before MSA. I would have to have a surgery because I broke something. I never got the flu. I only got pneumonia, but I really never got sick. I had COVID for about 4 hours and it passed. I never get sick from the easy things. I only get sick from the bad things, bronchitis, upper respiratory infection, pneumonia also. And as you can see, this chart, and if you compare it with the one before, or the symptoms, my autonomic respiratory is giving out. How bad? 3 pneumonias in 1 year. You have to learn how to look at your medical records. And I'm going to do that for you. Well, I'll have it look for you. On this sheet is a list of things that happen as I zoom in for you. All right. Yes, I hit my head falling in the bathtub. But studies have shown that TBI, traumatic brain injury, does not lead to MSA. So you have to take that out. I start to have urinary pain, right? testicular hydrocele swelling down there in that region. By March, still seeing doctors about the pain. There's cysts, but the pain is much more broader than just the testicle or cyst. It's like shooting places from my thorax. They thought that something happened to my neck. So my throat started to give out. Started July of 2021. Those are the first symptoms that there's something wrong with my musculoskeletal, my throat area. But you see all the muscles. I started to get pain in my hips. Could be sciatica, could be something else. I have an uncontrollable cough that lasts for months. Again, spondylitis. My lower back is falling apart. Myalgia. I've never said the word myalgia in my life, but the doctor just put this on here. It goes to spondylosis, lumbar, back is falling apart. I got sick. I believe that's COVID. Here, December of 21. In February of 21, my feet started dragging. I ignored it until December 14th, 2021. I went to my PCP, who I believe it was, and said my hands hurt. Right? Other issues, ignore anxiety and OCD. I've had those for a long time. Then here comes rheumatoid. I go to see a rheumatologist 1 year and a month after my feet drag. So it takes me over 4 months to get into rheumatologist in network at the hospital. They come up with, well, you test negative for rheumatoid arthritis. You might have seronegative RA, which the tests are unable to detect 50% of the times. So that was the theory. And to combat that, they gave me a low dose cancer medication, which the side effects were absolutely horrible. And I don't want to talk about them in public. Very, very bad for people who have cancer. Back to my back. Again, all this muscle skeletal. I'm starting to change my gait and movement. All this is leading to gait, movement, dexterity, muscle skeletal, carpal tunnel syndrome. Yes, I've had that forever. That's not a big issue for me. Nostalgia is a good word. I wish I had. Now, when you go to the hospital for things and doctors will diagnose you with things, you have to wonder, were they onto something? Longer-term permanent damage to the heart's mitral valve caused by an immune response untreated, leading to rheumatic fever. I did see a cardiologist for a little while. I'm not sure that was it. They diagnosed me with that, but I'm not sure that one followed through, or, MSA was playing tricks and made them think that. 22, almost 2 years, a year and a half later, my first symptoms, I start to slur my speech. A year and 8 months, my speech issues show. I also, at the same time, started punching my wife in bed, holding her hostage. So that's when REM, rapid eye movement disorder, REM disorder, precursors to Parkinson's and MSA, things like that, kicked in. That's when we had a study that proved it. It was happening before, but that's the study that, um, IU Medical. 6 days later, I come back because I'm starting to black out. That's when my, um, neurologist changed his, from rheumatoid arthritis to other specified degenerative diseases of the nervous system. That was a turning point. My doctors were able to see and change pretty much less than 1 year from seeing the doctor. February 21, 2021, I ignored my feet. Okay, take that away. I went to my first doctor about these issues in November, December of 21. In less than a year, me and my wife, we took every cancellation, every reschedule, any and every appointment they had. They started to change it. I saw a local neurologist, and she put the synucleinopathy disorder as well. They did some tests, disease of spinal cord. You can see when your autonomic functions are failing badly. A lot of it has to do with the spinal cord. That's why they do tests on your spinal cord, CTs and MRIs. Other sensitive signs about my GI system have started to go 1 year and 1 year and 8 months after my first symptoms, gastrointestinal, my pooping started to go where I could not go because the muscles stopped working in unison. And that's when also about when I started falling. Not sure about the amnesia. 1 year and 8 months later, after my first symptoms, I started getting shocking all over my body. Most of it has gone away, but I still have it from time to time. It sucks. It hurts. Back to unsteadiness. I cannot sleep. Arthritis I'm not worried about. Pain in my left shoulder. From falling. I tore my rotator cuff. And since then, I've had to put, for me to fall, it takes a lot. But all my falling, I tore both of my shoulders. Right hand, they did not find anything. It was just MSA or anything. There was nothing physically wrong with my hand. Again, pointing towards something neurological. I have a specific pain, not just in joints, but also in the middle of my hand. Started being anemic. Asthma starts to come back. Breathing issues. 2 years minus 1 month. My gait mobility is extremely hard. Very had COVID. It was COVID for 4 days. Poor wife had it bad, much longer. 2 years and 3 months, fatigue, MSA kicks my butt so bad I have to go to the doctor to see what I can do, which is not much. This is down IU Health for sure. They do a bunch of neuropsychology tests, and you start to see signs of cognitive decline. 2 years and 4 months after my first symptoms, I started having issues with urination. Now, I had issues well before this, but I wasn't sure that this was documented. This was a finding. We did tests for this. Urgency and incontinence happened years before this. Cramps and spasms of the muscles because you're not using them anymore. A tremor. That's when I knew something was bad. Like, deadly. It's not a resting tremor, it's an action tremor. 2 years and 4 months after my initial symptoms, the interior, inside tremor, action tremor started. Brain that started to fall apart. I do have a brain, I guess. Then I did some more tests of the diseases of the basal ganglia. That's what affected MSAP. It took 2 years and 6 months to get another diagnosis that it's a Parkinsonism. It was September 23, right? Here comes bronchitis, not the flu. David does not get the flu. David only gets the bad things, right? Bronchitis, no reason. Muscle wasting, atrophy. There are CTs and MRIs, or you can see atrophy with your own eyes on the body, not in the brain. No, that's you have to have a test. Accidentally stabbed myself. We'll move past that one. Here goes my thorax, right? Speech again. Can't sleep. They're treating my REM disorder. A guy that's almost 3 years later. Inflammation, irritation, or swelling of the esophagus lining caused by acid reflux. They put me on a lot of medications to stop that because sleeping at night and waking up to vomit in your mouth or coming out of your mouth is not very fun. Not very healthy. Hernia inside of my vocal, by my throat, my vocal cords. Who gets this? Somebody must. I told the doctors, yeah, just got it. Yeah. This one occurred in the lower part of my throat. I remember to me. But this one, in 2024, the beginning of 24 was when I said everything from my waist down is okay. Everything from my lungs up is moving very quickly, very fast. Like my voice today. Acid reflux, right? Stuff coming back from my stomach. Not very fun. Left arm, I'm so hurting because I'm compensating. It's torn. Over dysphagia. This was fun. Difficulty initiating a swallow, causing food or liquids to stick in the throat, choke, or regurgitate, often due to MSA. People say you can't run anymore, you can't swim anymore, you can't chug a can of beer anymore. You can. It's just hard getting initiating the movement. Right now, it's hard for me to initiate talking. We can do things, but starting and stopping is the most difficult part. In my pool last year, I drowned a few times, but point is, once I got myself kicking, I was okay. But stopping kicking and coming up for air is quite different. So that's very hard. Ulcers. I had so much vomit and stuff coming up that they had so many ulcers they had to take care of. My hands are still surgeons and say, well, do you see anything? And I'll test and say, no, we see nothing. So no need for surgery, but it's neurologic blockage in my throat. Impaired or altered function of nerves, muscles, ligaments, and joints in the shoulder, arm, hand, often resulting from trauma, repetitive strain, or poor posture. So MSA has taken, look at the column. MSA has taken my movement away from me. It's wasting away my muscles, so I can't do what I used to do before. This whole page, except for one, is muscle around the bones is going bye-bye. Thoracic spine. This is like all because of poor posture because of MSA. Poor posture. It's taking a toll. Yeah, I'm getting a lot of pain because I'm still fighting through it. I'm stubborn. Lack of coordination. Sleep apnea I've never had. This one they thought I had, but the test did not show that. Stiffness in joints. You're not yourself again, right? David is not David. David is disabled David. Weakness. I've lost so much muscle 3 years and 7 months into this disease. I can barely even move myself. This one I did not see coming. I never heard of this. All right, sorry, so hopefully it's Riley Day, not D-O. A rare inherited progressive neurological disorder permanent affecting Jews caused by genetic mutation. But the first part is familial dysautonomia, right? Or Vertigo syndrome. So They got me with familial dysautonomia, which a lot of people with PSP have. A lot of people further complicating the correct diagnosis, but do I actually have. This is more likely to be, people with PSP, but not MSA. 3 years, 6 months later, my gait gets worse. All right, back is hurting even more. The pain management is worse. Working on that just now. So 2 years later, I've got some nerves here. Distinct but related nerve conditions. Neuralgia causes intense stabbing, shock-like pain, damage, irritation. So this is the diagnosis for my shocking I complain about. It took a year or more to get diagnosed with the actual term for that shocking. This is a sensation. They got me on some medication, and it works. It took about 90% of the way. Thank goodness. Again, they have no idea what's wrong with my right hand. Heart is we talked about that. It corrected itself. Let's say when the lungs and heart go together, they are hand in hand. They are brother and sister. They are twins. So when your heart starts to have issues, so does your lung. When your lung has issue, so does your heart. You just may not see them. 83024 MSA diagnosis. This is the fourth diagnosis of the diagnosis. Might be from Detroit. Foreign body and respiratory tract. No clue. They they swallow a spoon. Moving too much. Difficulty in swallowing and transferring food from the mouth to the esophagus. Yeah. So not, it's weird how we have to tell ourselves to chew. So yesterday I had a piece of pizza. I could put a piece in my mouth and I wasn't chewing. Like 1 minute later, I had to tell myself to chew. Initiation is hard for everything with MSA. I do not have obstructive sleep apnea. When I have pneumonia, they always put that down there. I've never heard of this one before. You notice how hard it is to double and triple quick? Impossible. Shortness of breath is a subjective sensation controlled with breathing. I'll describe it as air hunger, chest tightness, or suffocation. Those go back to my laryngeal spasms that you heard on the audio file. Laryngeal spasms, there you go, right here. Randomly stop the vocal cords and the epiglottis. They will spasm, paralyze themselves for 5 to 30 seconds sometimes. And during that point, I cannot breathe or exhale or inhale. This is also striator, as I just found out yesterday. The only reason why is that we have not, my wife and I have not seen this as striator is because when my long throat muscles are so weak, I don't have the force to exhale to make the whistling sound. That's why. So when I show you the systemic failure, it's happening at its own pace over last year. Last year was rough, very, very rough for me. And a lot of that is because of everything to do with the throat, esophagus, asthma. So we took care of that. Nebulizers for that. Voice and resonance disorder. This, why you hear me raspy right now is because of the saliva pooling in the back of my throat that I cannot swallow down. I just swallowed, and I'm still raspy. They say to take a drink, it gets stuck in the back of my throat. Yeah, I'm still raspy, even more. But doesn't that make sense? After I drink, I sound even more raspy because there's more liquid stuck in the back of my throat. Saliva pooling. I think my last video, that's what happened to or pneumonia and swine flu at the same time is either die or inhale your saliva. I hope I hope your grit in life is as strong as mine is to stay alive because I inhaled a whole bunch. So there are some nebulizers that they can give you, some breathers to help break that up. I mean, and there are some medications, but they don't always work. Please, if you have saliva pulling, if they do a barium soil test with or without radiation or modified barium soil test, ask them if you have saliva pulling. Usually they show you the video in real time, and you'll see this liquid still in the back of your throat. You'll say, "What's that?" That's saliva pulling. Your throat is not capturing, is not gathering and moving everything down at once. Your muscles have become uncoordinated and weak. This is why they start to choke on everything. Progressive neuropathy, more pain, going everywhere. Another doctor comes in and says, "Guess what? I can't say it. It's MSA." Another diagnosis is MSA. It gets interesting here in a second. Was it March of 20? I'm just trying to find it. So you start to see chest pain, headaches, chronic pain, contusions. Or they did an X-ray of my body for muscles, not looking at for bone. You're like, "Damn, Dave, how many contusions can you possibly have in the body?" I fall a lot. I hit a lot of shit. It hurts, but I get my ass back up and I keep going. They were flabbergasted by how many individual contusions the bone and muscle I had. Primarily on my right side, 'cause I'm right-handed, which is why at that time, I didn't wanna fall on my left shoulder, so I fall right, and I tear that rotator cuff too. ADHD I had for a long time. This was all taken care of with surgery. If you have MSA and you need to get a shoulder, hip, or whatever replacement, do not do it. I'm strong. I'm stronger than most of you, and I'm not being cocky. I'm just younger and been active my whole life. And getting over this shoulder replacement with MSA was the worst thing that I did. It's the worst thing. Please don't do that. Find another way. At least go arthroscopic. Don't replace the whole shoulder or hip or knee or whatever. Go arthroscopic. If they can fix it that way, much easier. Fibromyalgia, just myalgia. Hips, lower legs, upper arm. I fell. I'm hurting myself. Fell on my shower again. Happy New Year, 2024. Also, 4 years later, my actual neurogenic orthostatic hypertension comes into effect. They actually document it. You know, I've had it before. I've been blacking out forever. They were just able to prove it on January 17th, 2025 with testing. But myoclonic jerking. I am watching the Olympics this year. And damn if I don't mimic what the Olympic athletes do. I'm watching curling, and they're scrubbing, I'm scrubbing. I'm watching speed skating. They're kicking their feet, I'm kicking my feet. I jerk for no reason at all, or sometimes it's a jerk for like things I'm imagining in my head, daydreaming, for instance, or by watching TV. It's very interesting, very annoying too. This is like syndrome I've had for years. They just diagnosed it at the time. The stenosis, back is falling apart. It's falling apart because I'm leaning forward to compensate for walking. I said this before. I'm leaning on my tippy toes to walk now, causing my minimal scoliosis and unusual back pattern to prevail, and it's causing my back to pinch at points where it shouldn't be pinching, or falling apart, or falling on your ass is just as bad as falling on your head. Once you hurt those bones under the lumbar section, your back hurts forever. Very bad. You can be careful. People think just fall on your butt. Yeah, that's gonna ruin something down there. Leg pain. Pretty sure this is when I went to the hospital. I couldn't move my legs. I don't know, just foreign body. Oh, yeah, pneumonia. Right, pneumonia. Supposed to have a surgery for my shoulder replacement, and that happened because of pneumonia. I took a COVID, and I only had it for 4 hours. I had night sweats for 4 hours and went away. Easiest COVID I've ever had, which I only had one time, I think. That one. Fever stops by surgery for my shoulder. Apparently, I have pneumonia again. Emphysema, dramatic. The entrapment of air in the subcutaneous tissue planes commonly resulting from chest trauma, rib fractures, pneumothorax, penetrating injuries. Look what it is. It's definitely on the pneumonia track. Altered mental status, pneumonia. Did you see respiratory? Was the worst thing I ever had. This one was the first one. It was terrible. Oh, my wife has videos I could show you. I'll have her send me out to do a video on it. This was when respiratory failure was actual real. Um, I was breathing 4 times per minute. You should be at like 12 or above. 4 times per minute does not get you a lot of oxygen. It was pneumonia, which again, I blow. You have yeah, hyperexia because I can't breathe properly. The I was called this CO2, but it's not CO2, that's CO2. You get the wrong gases in your blood. And when they put a needle in your vein for blood, it's easy. When they put a needle in your not the vein, the other one through your knuckles, it hurts like hell. Them testing for gas in your blood is horrible. I miss this one. Partial or complete collapse of lung lobe. That pneumonia about killed me. It collapsed my lower lobe and my upper lobe. I still have my middle lobe. You have three lobes in your lungs unless something happened to you. It collapsed 2 of them. So you can imagine somebody with MSA. This is at post-surgical with my arm too. You can imagine how horrible that must have been to collapse 2/3 of your lungs. How the hell you get if you collapse the top, how you get air out? They're literally forcing me. Tachycardia, irregular heartbeat. Again, these are things that people don't know. There's some things in here that my mother doesn't know. There's some things in here my wife doesn't know. They're on here because they happen. So except for one or two that I know for sure. Is tachycardia misdiagnosed during admissions to the hospital for life-threatening pneumonia with MSA? No, it's the heart playing games with the lungs. Like you can read anywhere. Lungs and heart go together. Well, I did something wrong here. Inflammation of the lung area because of inhalation of food and vomit. When your lungs stop, the muscles stop working correctly. That's what happens. That's why you see people like Daisy and myself going and having Botox to try and stop this, or go even dilate your esophagus, your throat to widen the muscles out to make them work better. And then here's one that I want to. This is very important. I didn't realize this. Mm, 1 year ago, I had pneumonia, and it came up with this term: hypomyelination with atrophy of the basal ganglia and cerebellum. I know what the second part is. The first one I did not know. Usually, hypomyelination is found with kids. Only found in children. It impairs the formation of myelin, which is the insulation from nerve cells. That's why we start to fall apart because the coating of our nerve cells is not there anymore. But MSA can mimic. It turns into hypomyelination if it's from MSA. But having MSA can mimic a childhood disease that's very, very bad. And the atrophy of the basal ganglia and cerebellum, you start to lose mass of the brain. That was 1 year ago. I didn't know that. And I check my records all the time. And I went back to see if that's true, and I'll show you if it's true. And disordered autonomic system, pneumonia. This is all in the hospital. Acute chronic respiratory failure was hypoxia, joint replacement follow-ups, essential hypertension, high blood pressure. Other specific enteropathies. Or another diagnosis of MSA, spondylosis without back falling apart, deteriorated osteoporosis. I had that for a long time. No fracture, yet osteophytes or MSA. That's what my wife said. What's MSA? Never heard of it. So mild neuro could be a lot of things, but this is something you might get if they're fishing, if they're on the right track. Dysfunction in the connections between nerves and muscles causing progressive muscle weakness, fatigue, cramping, and twisting. Something you might see like in ALS, but it can happen in other diseases too. So EMG is one way to rule it out for sure. Yeah, I've had a lot of EMG, so and then I know it wasn't that. Increased blood pressure, it's up, it's down. Neurological muscle weakness now. Chronic respiratory cognitive functions and learners go down, depression, again, they see more IM in another test, pain, physically impaired mobility, and ADLs. Now they're saying you can just say, well, we see it now medically. Therapeutic level monitoring, take all the pills. Neuromuscular function is powered. They have just validated what we knew 2 years ago. Besides constipation, often it's disorder. It's dysphagia, dysphonia is the voice, so the saliva. Viral pneumonia, he came back from Las Vegas and had the swine flu, the H1N1 back from 2009. That was the last pandemic before COVID. That was during President Obama's term that came around. Started in the U.S. Again, this is urgency, other things. Now, what I'll show you real quick. You always want to have CTs and MRIs done on a regular basis with MSA, but they cost a lot of money, and you gotta have a reason to do them. So I had a CT because before that pneumonia, March 3rd, into February all the way through after surgery, and it was second pneumonia of the year. I fell out my bed. That's when I had a temperature of 103.5. And we went to the hospital, and I said the left side of my head was numb, the side of my body. So they're looking for strokes. Now, this is the part where if your name starts with Denise and it ends with the sound if, you should probably not watch this. One warning, this is a CT. I have an MRI from a couple of years ago. Look at the outside where the brain matter meets the skull. Now, these lines should be tightly packed. For instance, this line right here, which seems okay. This one seems okay. This one does not. See how much black? The more black and wider the wider the strands or the rivers, the creeks, whatever you want to call these things, the creases, the wider they become and the darker the color is the atrophy of the brain. You can see it opening spaces. And you will see some, again, like these lines are perfectly normal. They look good. But as you look towards the back of the cerebellum, we're starting to lose the cerebellum part of the brain. Atrophy is it's pulling away from the back of that brain. Cognitive seems the sides. Again, you can see the sides of the back of this thick, the big black parts and wide is the atrophy. And then the enlargement of the putamen. It might be hard for you to see. Very dark black right here. Very dark black right here. You see dark black, light, dark gray and light gray are okay. But black is bad. The putamen, caudate. You see it trying to make some inroads, right? Then you get into the third and fourth ventricles, which is area in the middle is opening up as well to not be as big as well. We're looking the other way. What a weird picture. What's all these little things? All my nose, still in my mouth. Look at the brain at the top. You see dark black. That's atrophy. You can see right here, where my mouse is right in the middle. The hemispheres are splitting apart, shrinking. You see it, even the black and black. That's atrophy, right? You can see a gap in here of CSF, cerebral spinal fluid. There's more and more black around the outside. And here comes your putamen and caudate. You get a piece of it. It's enlarging. The enlarging is not good. Down here at the back as well. I spent a lot of time. Look at the images at the top. See how now the lobes, the hills of the brain are greatly pulling back. I mean, you can see it from a different angle. When you get in the hemisphere, it does split, but it's not supposed to split like that. Not supposed to have space. And then everything here in the middle with the putamen. This is your fourth ventricle. I mean, there's a lot of opening here. It's not even uniform. You know, the brain is definitely. I have a brain. I promise I do. You can see the back of the lobes of the cerebellar pulling back. So on the bottom, you see that? This is looking from the back of my head. Look at atrophy. Look at the lobe. Left lobe is sticking out as it should stick out right when it is atrophy. It is significantly shrunk. So what does that lead us to? I know it's a long video, and I showed you that chart of rate of decline. I'm a person who doesn't go to hospitals unless you force me to, or doctor appointments. PT I'll go to. With everything that happened in last year, 4 near-death experiences, one from choking and 3 pneumonias. 6 is going to be a hard year. And I had a speech that I was going to say about this on a different video. You made it this far. You know, you must understood me. And B, I want you to know that I am not suffering. I mean, the people around me are suffering. The people around me that love me and care for me, they're suffering. They had to change their livelihoods because of me, change their plans, change who they are. From a nurse to a bedside nurse or whatever. I mean, from we're working at a law firm to being a caregiver. I'm okay with this MSA diagnosis. It happened. It is what it is. I hope that there's something after death. But I don't. One thing I don't do is bring people around me down. I do tell my wife new things, unusual things, just in case something happens. Oh, he was just complaining about chest pain. It's just good info to have on the way to the hospital. The other thing is telling my wife new symptoms that are happening. You know, we ask ourselves, oh, should we go to the hospital or a doctor or schedule something? It's a team effort. I don't struggle. I find other ways to get things done. I still eat what I want to eat. Unfortunately, cost me a couple of hospital visits. I still walk and do the thing I used to do. Not as much, but it cost me shoulder replacement and then another torn shoulder over here. I still don't use any assistance in peeing and pooping. Sometimes I don't make it in time, but I'm not suffering. I refuse to take every single pill because some pills create more problems than they solve. One thing we can't sell right now is restlessness. What a horrible feeling to have true restlessness. If you feel like you're going off yourself because you can't stay still for more than 10 seconds, it's awful. There's only sort of Xanax and other medications that work out to help that out. There's a downside of medication. So when you look at me, you see my posture to the right, and MSA for you. When you see me in videos and like the Botox injections and surgeries, and I'm not suffering. I've had all this stuff before. I've learned how to walk again. After I broke my back, after I had 2 knee surgeries, dead ligaments. They're showing me how to place my feet again. There's nothing new to me. I'm just learning how to adapt to new things. I'm learning how to control my diet, stop eating too much chocolate cake. But, please don't make this more than it has to be for other people. I'm not saying about anybody in specific, but you control as much as the person next to you does. You control as much as they do. Your caregivers, your family, your friends. If you want to wake up every day in a grouchy ass mood because you have MSA, you're not gonna live long. If you wake up and say, you know what, I'm not gonna take anybody down with me. Just say I'm gonna be positive. Do it for you. You're going to live longer. You're gonna be stronger. You'll find ways to get things done. But also you have to know what's wrong with you. What a doctor says to your face is not necessarily what they put in your report. I would have never known about my muscle atrophy in my brain if it wasn't for a CT scan. It says mental status changed, unknown cause. Reading it right there. Clinical indication, mental status changed, unknown cause. Atrophy of the brain. So you have a doctor that says one thing, and the technicians or radiologists says another. Your PCP says another. You have to look at your records. And I encourage you to use my FHR website. My family, I'm gonna type it in for you so you can see my password. It's my last name. Few of us know about this. myfhr.careevolution.com. This Google my FHR, and you can literally see all medication history, immunizations, allergies, reports from hospitals and doctors, your actual conditions, every procedure you had. You can link your hospital your records to your data. You can share all your data with somebody that you care about. You can view the whole timeline, what is happening. I just had Botox 2 days ago, 3 days ago, it's here, right? So this is the best all-in-one medical thing I've found. And I think Sarah shared she talked about it was, Daisy and I. And Daisy did it too. Yeah, so I signed up for it. It has everything in one place. Everything. That pulls records that your MyChart and Epic stuff, other portals don't pull. That's how I found out about these other conditions and issues that they just thought I had and I actually had by looking through this. So this is my 5-year review of having MSA. I hope 2026 will be fruitful and beneficial for all, for myself. But right now, my biggest issues are, you know, my voice and my lungs. So my legs are going to stay with me until I die. So that random guy in Las Vegas on the street that said, he looked at me and said, die on your feet. Amen. I will die on my feet. I will not be confined to a bed or a wheelchair. I have my feet. They keep going. These legs keep turning. No matter the falls, the hits, the trips, nothing. As long as I don't break the shit out of them, I will keep going. And you must do the same thing too. Keep going. Don't give up. This year will be lungs and everything in the throat for me. Everything else is pretty much under control. It's not getting quite out of hand. But if you want more specific information about my timeline or anything, I'll be glad to leave me a comment or message me some. I'll be more than happy to help out. But you know, 2026 to me doesn't seem like a good year. Given how bad the last year went, it only gets worse. I just had Botox 3 days ago, 2 days ago. I already aspirin pills. They're getting stuck. They sit in there for 3 hours, dissolving in my throat. I got to have my whole bunch of ulcers now in the future. So I'll be here. There will be another video. And remember, don't just be strong. Be MSA strong. I'll see you in the next one.